Here is a question on lipoproteins. Which of the following plasma lipoproteins is best described as follows? The points are: it is formed for removal of triacylglycerols from VLDL and it contains cholesterol taken up from HDL and delivers the cholesterol to the tissues. So there are 3 points. 1. It is formed when triacylglycerols are removed from VLDL. So synthesis is from VLDL. Then it takes up cholesterol from HDL and it delivers all the cholesterol to tissues. Which probable lipoprotein is that? Here the answer is LDL or low density lipoprotein, which is otherwise known as bad cholesterol. Why is it bad? Because it transfers all the cholesterol and deposits in the various tissues, and you all know depositing cholesterol in the tissues are dangerous to health and it can cause occlusion of the blood vessels, leading to a variety of clinical manifestations like coronary artery disease, stroke and peripheral arterial diseases. Now we have the second question. Which of the plasma lipoproteins is best described as follows? It is synthesized in the intestinal mucosa, which is the first point, contains a high concentration of triacylglycerols, which is the second one, and it is responsible for the transport of dietary lipids in the circulation, which is the third point. So here, synthesized in the intestinal mucosa and more amount of triacylglycerols, that too especially the dietary lipids, is the most common lipoprotein which satisfies all these features are chylomicrons. Chylomicrons are transport carriers of lipids in the blood, which will carry all the triacylglycerols which is present in the diet to the liver. So because it needs to carry something from the diet, it is present in the intestine, or it is synthesized in the intestine. And you know something about this chylomicrons? After a high fat meal, once you take a high fat rich meal, your chylomicrons will be elevated in the sample, in the blood sample. Suppose what will happen and how will the sample look if your chylomicrons are elevated in the sample? You will have a milky serum. The serum which separates appears milky and you refer the sample as lipemic sample. A lipemic sample indicates that there is high amount of triacylglycerols in it, and that is possible due to the presence of chylomicrons. Now let us see the next MCQ based on this. Which of the following plasma lipoproteins is described as follows? Synthesized in the liver, high concentration of triacylglycerols, cleared in the circulation from adipose tissue and muscle. We saw the previous MCQ where we saw the high concentration of triacylglycerols, that was chylomicron, but that was synthesized in the intestine. Now you have the additional clue where it is synthesized in the liver. So any endogenously synthesized triacylglycerols, usually triacylglycerols are synthesized within the liver, and those needs to be carried, endogenously synthesized triacylglycerols are carried in the blood by using VLDL, or the very low density lipoprotein. This VLDL is important in this aspect, that is VLDL, once it gets metabolized, it gets broken down into IDL, or the intermediate density lipoprotein, which further on degradation gets the LDL, or the low density lipoprotein, which is the bad cholesterol, which we saw. It goes and deposits the various cholesterol to all the tissues, which causes serious deleterious consequences. Now the only thing which we have left out is our HDL. HDL is a good cholesterol and it is because it transports all the cholesterol to the liver for excretion in the form of bile. So these are the various lipoproteins. We have seen about chylomicrons, which are synthesized in the intestine and increase after a fat-rich meal high in triglycerides. We have the VLDL, which carries the endogenously synthesized triacylglycerols, and this also carries triacylglycerols. Then from the liver to the other tissues. Then we have the LDL, which is synthesized from VLDL, and it is a carrier of cholesterol, and it is a bad cholesterol. It goes and deposits all the cholesterol to the tissues. Now finally we have the good cholesterol, which is HDL, takes the cholesterol from all the tissues and gives it to the liver for excretion. These lipoproteins are carriers of lipids in the blood.